A patient came in a few months back holding an MRI report and said his surgeon told him there were exactly two options left: a cortisone shot or surgery. That's it. I told him there was a third option nobody had mentioned, and it's the one I reach for most in this office. That's what we're getting into today. This is the Rare Wellness Podcast. I'm Dr. Jamie Lewis. No guest this time, just me and a topic I get asked about constantly in the clinic: focused shockwave therapy. What it actually is, how it works, and where the evidence is strongest. Tendon problems like tennis elbow and rotator cuff, and joint pain from osteoarthritis. Before I get going, a quick note. This show is put on by my own practice, the Center for Regenerative and Performance Medicine, up here in the Pacific Northwest. Find us at c4rpm.com. And the part I say on every episode because it's true. This is general education, not advice for your specific case. Get seen by a real provider before you try anything you hear about here. Here's why I reach for this instead of another cortisone shot or another round of physical therapy that isn't moving the needle. Shockwave fixes the tissue instead of just quieting the symptom. A cortisone shot can calm things down for a few weeks, but it doesn't make a tendon any healthier. And if you keep going back for more, the cortisone actually weakens the tendon over time. Shockwave does the opposite. It triggers your body's own repair process, aimed at exactly the spot that's hurting, with no needles, no drugs, and no downtime. That's why it's earned a permanent spot in our toolkit. So what is a shockwave actually? If your mind jumps to lithotripsy, the machine that breaks up kidney stones, that's a good instinct, because that's genuinely where this technology comes from. A shockwave is a very fast, high-pressure sound wave with an extremely steep edge to it. Take that same physics, dial it way down, and point it at soft tissue instead of a kidney stone. And instead of breaking something apart, it becomes a signal that tells your cells to start repairing. The key word is focused. The wave is generated outside your body and then converged to a small target, like a magnifying glass focusing sunlight to a single point, several centimeters deep. That means we can drop the energy precisely on a rotator cuff insertion, an elbow tendon, or a knee joint, while your skin barely notices anything happened. Here's the science in plain language, because I think this part is actually the most interesting piece. The cells in your body can physically feel pressure. That's not a metaphor. They have sensors for it. And the wave passing through triggers three things in sequence. First, it releases growth factors and signaling molecules that basically shout, "There's an injury here, get to work." Second, your body grows brand new tiny blood vessels into the area. This matters because tendons have notoriously poor blood supply on their own, which is exactly why they heal so slowly. Shockwave reopens the supply line. And third, the cells responsible for making collagen switch back on and start laying down new, organized tendon fibers. We're not numbing anything. We're turning the construction crew back on at a job site that's been sitting abandoned for months, sometimes years. Now, a lot of patients tell me they feel better after just a couple of sessions, before there's been any time for actual tissue to remodel. That's because Shockwave is running on two different clocks at once. The structural healing is slow, weeks to months, but there's also a fast effect where the wave quiets down hypersensitive nerve endings and interrupts the chronic pain loop almost immediately. So you often get real pain relief in the first 2 or 3 sessions, and then the deeper rebuilding keeps going for another 2 to 3 months after that. I want to clear up something that trips a lot of people up. Patients regularly tell me, "I tried Shockwave somewhere else and it did nothing." When I dig into what they actually got, it's almost always radial shockwave, not focused. And those are two completely different tools wearing the same name. Radial devices are basically a pneumatic hammer. They deliver a pressure wave at the skin surface that spreads out and fades fast the deeper it goes. They're cheaper, they're fine for a superficial trigger point or a big muscle group, but they physically cannot deliver meaningful energy to a deep target. Focus shockwave converges to a precise point inside the tissue, typically 2 to 6 centimeters deep, with more energy landing exactly where it needs to. When trials put the two head-to-head for rotator cuff and tennis elbow, focused wins, especially when you check back at 6 and 12 months. So if a shockwave treatment didn't help before, it doesn't mean the therapy doesn't work for you. It often just means the wave never actually made it to the tendon. Let's get into the actual conditions. Tennis elbow first. That ache on the outside of your elbow that makes gripping a coffee mug or shaking someone's hand feel like a chore. That tendon has usually been quietly degenerating for months, sometimes years, before it ever hurts enough to see someone about it. The 2024 randomized trials show focused shockwave significantly reduces both the pain and the grip strength deficit compared to a sham treatment. And that benefit is still there past 6 months. And in head-to-head trials against radial, focus was the only version that actually improved night pain, the thing that keeps people up. Rotator cuff is a similar story. Reaching overhead for a cabinet, rolling onto that shoulder at night, the stuff that quietly stops people from doing things they used to do without thinking. A 2024 systematic review and meta-analysis looked at focused shockwave for rotator cuff tendinopathy, both the calcific and non-calcific kind, and found real reductions in pain and real improvements in shoulder function. What stood out most was how long it lasted. Patients who got focused shockwave were still doing better at 24 and 48 weeks than patients who got radial. So if you've got stubborn tennis elbow or rotator cuff pain that hasn't responded to rest and physical therapy, this is one of the better supported non-surgical options on the table. Now the big one, joint pain from osteoarthritis. 5 or 6 years ago, using shockwave on an arthritic joint was still considered experimental. Not anymore. There are now dozens of randomized trials, mostly in the knee, and the signal is consistent. A 2024 network meta-analysis pooling 69 trials found focused shockwave significantly reduced pain, improved physical function, and outperformed conservative care alone. A separate 2024 trial showed real gains by 8 weeks, and the researchers behind it concluded this could actually delay or reduce the need for injections or a joint replacement in mild to moderate disease. There's even imaging to back it up. Pilot studies looking at MRI bone marrow lesions, which are a known marker of painful arthritis, showed those lesions shrinking after a course of focused shockwave. The likely mechanism mirrors what we see in tendons. Better blood flow to the bone under the cartilage, growth factors supporting cartilage health, and the pain pathways in the joint itself getting quieter. Knees are what we treat most often, but the same principles apply to hip, shoulder, and the smaller joints in the hand and foot. So what does an actual course look like? Each session runs 10 to 15 minutes. We use gel on the skin so the wave couples cleanly into the tissue, and we deliver somewhere between 2,000 and 3,000 pulses per session, dialed to whatever intensity you can comfortably tolerate. Most people don't need any numbing at all. A standard course is 3 to 5 sessions, about a week apart, and most people notice a change by session 2 or 3, with the deeper healing continuing to build for 2 to 3 months after the last visit. The best results come when we pair shockwave with targeted strengthening and load management. The wave triggers the biology, and the exercise tells that new tissue how to organize itself. On safety, the profile here is excellent. The most common side effect is mild soreness or some skin redness for a day or two, nothing more. We don't treat over an active infection, a known tumor in the area, or a pregnant abdomen. If you're on blood thinners, we screen carefully first, since focused shockwave can cause small bruising in deeper tissue. And we avoid treating directly over surgical hardware. Outside of that, this is one of the safer tools we use in musculoskeletal medicine. No needles, no medications, no sedation, no downtime. So if you remember one thing from today, focused shockwave is a precise acoustic pulse that wakes your body's own repair machinery back up at a deep target. New blood vessels, new collagen, quieter pain nerves. Focused is not the same thing as radial, so make sure whatever you're getting is actually reaching the tissue. The strongest evidence is in chronic tendon problems like tennis elbow and rotator cuff, and in osteoarthritis, especially the knee, where it may help you delay or avoid injections and surgery altogether. A typical course is 3 to 5 sessions over a few weeks. No needles, no downtime, and the healing keeps building for months after we stop. If you want to know whether focused shockwave could help your specific situation, head to c4rpm.com. And if today was useful, subscribe, leave a review, and send it to the friend who's been babying that elbow or that knee for way too long. This is Dr. Lewis, and if you've heard me say this before, it's because I mean it every time. Your body has an incredible ability to heal, thrive, and repair. Sometimes it just needs the right tools to unlock that potential. I'll see you next time.